I'm Kyul Kim, a nursing student from Cornerstone College. I propose expanding screening to prevent prostate cancer among American men. In Canada, prostate cancer is the highest mortality cancer among men. Despite this, according to Dr. Kishak's research, indigenous men are less likely to be screened for prostate cancer than non-indigenous men, and their incident and mortality rates are higher than non-Aboriginal men. The ongoing racial and cultural discrimination against them, as well as lack of information, are major barriers to healthcare access. I propose two solutions. First, the mobile neurology cancer clinic and laboratory should be expanded across Canada to improve access to care. Second is expansion of related education. Training materials should be in indigenous languages, and learning should be conducted via internet to enable remote connections. I believe that healthcare should be provided equally to all Canadians. If you have any further questions on this issue, please feel free to contact me at my email. Thanks for your listening.
Hello, my name is Juliana Kim, and I'm a nursing student at Cornerstone College. I'm concerned about the oral health disparities among Canadians. Canadians rely on private insurance or job plans for dental care or payout for care not public financing. This many Canadians to be passive for dental treatment, resulting in oral health disparities. I suggest two options. First is highly recommending visit to an oral care specialist once a year. Increasing access to primary care can prevent oral visits and unnecessary medical expense. Second is implementing of dental care system in the local public health center. It is increased access to dental care for low-income patients and people living in rural and remote areas. Thank you for your time. Let's make a lasting impact on oral health in Canada, because the healthy smile should be a right, not a privilege. Thank you.
Hello, Honorable Ms. Jones. My name is Anjali, and I'm an international nursing student from Conestoga College. I want to talk about immigrants' health in Canada. Immigrants occupy 1/5 of the Canadian population. However, they often face challenges when using healthcare because they don't know about Canadian system. For example, when I booked an appointment to see an eye doctor, I first needed a letter from the primary care provider in the school clinic. However, in my home country, I could visit an eye clinic by myself. Newcomers often expect similar care that they received at home, so it was a challenging experience for me. A lack of knowledge about complex systems could affect public health and eventually increase social costs spent on healthcare. So, I suggest making a brochure of nearby walk-in clinics and emergency departments for those in urgent situations. Also, I'd like to ask you to hold a campaign to provide this information to immigrants. Thank you for your time, and I look forward to your response.
Okay. Hello, my name is Kyu Min Jang, and I'm a nursing student from Conestoga College. Currently, lung cancer screening plays a very important role at a time to detect early stage of cancer. However, lung cancer screening with a few more changes, we can move in a better way. So, I'd like to highly recommend two options. First, we need to promote Ontario lung cancer screening policy using YouTube or mass media advertisements such as television, radio, newspaper, or electronic billboard, so that Ontario citizens can get more knowledge and information about the importance of lung cancer screening. And second, lowering this screening age from 55 to 50 would help to detect the early stage of cancer. Also, managing screening targeted population would contribute to the Ontario health financial wise. I really appreciate the opportunity to discuss this with you. Thank you for your time.
Okay, great, thank you.
Hello, I'm Itonon Onoshikot from Conestoga College. I'm here to advocate for limiting the use of cannabis in youth. Did you know that Canada has one of the highest rates of cannabis use? The highest is that rate is among young people ages 20 to 24, followed by those ages 16 to 19. Using cannabis during the critical phase of brain development in youth can lead to concentration and increase the risk of addiction and physical and mental health problems. To address these issues, I welcome that House and Retail Canada raise the age of access to cannabis from 18 to 21 and implement strong mandatory education programs starting in early childhood to change the youth and parents' perception about cannabis and promote behavior change. But I think these majors can contribute to your overall mental and physical well-being. If you have any questions, please contact me by email. Thank you for your consideration.
Good morning, Honorable Silvia Jones. I am James Eli Antonio, an international nursing student from Conestoga College. After the COVID-19 pandemic, nursing workforce shortages persist in Ontario. This puts a significant risk to the public's welfare and burdens the healthcare system. I am advocating for my fellow internationally educated nurses to simplify the registration process to become a registered nurse in Ontario. This will not only address the staffing gaps but also enrich the diversity of our healthcare workforce. Moreover, this will ensure that holistic and culturally competent care will be provided for our diverse population. I am humbly request for your support to urge the College of Nurses of Ontario and the National Nursing Assessment Services to cooperate for this matter. Together, we can address the workforce gap this early quarter of 2024. Thank you.
Hello, Honorable Sean Fraser. My name is Adrian Rosa Mistosa and I'm a community nurse in Kitchener-Waterloo. I want to discuss the growing crisis of homelessness in Canada. Homelessness is a critical issue due to far-reaching consequences on health, employment, education, safety, and more. According to the Canadian Observatory on Homelessness, approximately 235,000 individuals experience homelessness in Canada. Therefore, I highly recommend that Canada implement a comprehensive plan to reduce homelessness by 20% in the next 3 years. This can be achieved by expanding tenant rights, strengthening community engagement, and encouraging partnerships across various sectors. The plan should cover healthcare, substance abuse, job opportunities, education, safety, legal challenges, and housing market pressures. It is crucial to establish a timeline with specific milestones, regularly evaluate progress, and make necessary adjustments. I hope you will consider my recommendations and take action to address this pressing issue. Thank you for your time and attention.
Okay, hello Minister Patty. I'm Elizabeth, a nursing student at Conestoga College located in Kitchener, Ontario. I am aware of your hectic schedule, but I am here to talk to you about an urgent issue concerning Indigenous people. I'll be brief, so please give me a chance to speak. I know that the government is working very hard to address the problem managing the shortage of safe drinking water in nation's Indigenous communities. However, many areas continue to lack access to potable water. As we all know, clean water is essential because it is a part of basic human needs. Having said that, I'd like to recommend some possible solutions. First, the government can increase the availability and accessibility of high-quality drinking water by installing more potable water dispensing units in the area. Secondly, is to collaborate with some of the water companies such as Nestle Canada to help supply bottled water in the community until the water system is in the area is stabilized. And lastly, the government can send some trained and certified operators to manage the public water system that are available in the resource communities. By doing this, those water systems can be used to supply clean water in the long run. I came to you because I know that you have the influence and the power to raise this issue with our government leaders. Allow me to give you my contact details for your reference. Thank you and have a great day.
Hi, Sylvia Jones. It's an honor to meet you. I'm Samela Somashara, an internationally educated nurse. In fact, I'm in the process of obtaining my RN registration here in Ontario. I'm so excited to be part of the workforce soon, but it's a sad reality that more and more nurses are leaving bedside nursing. I've read of increasing workloads being the cause of burnout in the workplace nowadays. This also badly affects patient outcomes and increases healthcare expenses. But I strongly believe that safe nurse-patient ratio can definitely help retain nurses. If BC successfully implemented such scheme recently, we can even do better. We both share a common dream of building a stronger healthcare system for the Ontarians. Would you consider partnering with me through the Registered Nurses Association of Ontario, of which I'm affiliated with? Help us initiate a minimum staffing ratio policy. Thank you for your time, Max. Send an email as soon as possible. Have a good day.
Perfect. Very great.
Hello, Mr. and Mr. Healthcare Administrators. My name is Jung Shan, and I'm a nursing student at Conestoga College. I'm deeply concerned about the escalating issue of marijuana smoke in the public space since its legalization in 2018. With 1 in 5 Canadians suffering from various lung diseases that are sensitive and vulnerable to the smoke, the prevalence of the marijuana smoke in public area poses a crucial health risk. Despite tobacco bans, marijuana smoke remains a pervasive form of air pollution, affecting not only current citizens but newcomers might unaware of the danger. I propose the creation of exclusive smoking area and restrict zones to accommodate the growing demand for marijuana smoking consumption while safeguarding public health. I'm gratefully appreciate your insight and potential training strategy to addressing the present health concern for well-being of Canadians. I will send a brief note by email later in the day. Would you mind sharing any relevant views and planning from ongoing meeting of your team? Appreciate. Have a nice day. Thank you.
Hello, my name is Pankaj. I am a nursing student from Nashua College, which is rated 8 college in education and one of fastest growing colleges in Ontario. Today I would like to talk about the immigrant health. As we can see that Canada is the most country in present time. According to Statistics Canada, more than 8.3 million people came as immigrants in year of 2021. Growing number of immigrants are moving in search of better life, employment and education. However, National Library of Medicine revealed that significant number of immigrants are suffering from poor mental and physical health as a result of inflation, unemployment and housing crisis, which is the very concerning for Canada's economy. Therefore, developing more job opportunities, building cheap accommodation, providing food bank support and mental health resources would help to improve immigrants' health. Thank you so much for your time.
From Conestoga College, who is passionate about caring for older adults. My concern is to the federal government of Canada. Research has revealed we live longer in this time, and most of our older adults prefer aging at home due to its enormous benefits. Thanks to the federal government for your support so far in funding the home-based care and community services. However, due to the increase in the following services and lack of funding, it is seen that if this continues, it will affect the older adults in living healthy in the homes which they have preferred. Now, to this regard, my recommendation is as follows. Number one, that the federal government should train volunteers to care for older adults. Number two, the federal government should recruit community health nurses to help in this regard. And lastly, that the federal government should cut down on non-essential services and increase the funding on home-based care and community services. Supporting aging at home will ensure older adults to receive best care, and federal government will spend less on institutionalized care, which is more expensive. I thank you for giving me your time. If you have any further information that you want to pass across and you want to collaborate with me, I'm very much available. Thank you for giving me your time. Bye.
Okay, good morning, Minister Silvia Jones. My name is John Ray Peralta, and I am the Community Outreach Coordinator here in Kitchener. I would like to discuss briefly the crucial matter on non-medical cannabis use in the province. So although the Cannabis Act of 2018 has a positive impact on the economy, we must address the challenges in regulation, public health, and social impact thoughtfully. So I propose two key strategies. First, strict regulation. So we need to enforce age limits, licensing, and monitoring to ensure responsible consumption, especially among youth, prioritizing public safety. And secondly, youth-centered prevention programs. This will educate our young individuals on the hazards of cannabis use and empowering them to make informed choices. So in conclusion, Minister Jones, a balanced approach is very crucial. Strict regulation and comprehensive programs will promote responsible cannabis use, prioritize public safety, and safeguard our young people. So I appreciate your time and I'm open to discussing it further. So here's my email address and have a good day.
Okay, great.
Hello, good morning. Honorable Silva Jones, my name is Justin Lapuente. I am a registered nurse in the Philippines and I'm currently studying under the program of Enhanced Practice for International Students at Conestoga College, Kitchener, Ontario. I would like to address the issue regarding stress among nurses. Nurses often face challenging situations, physically, emotionally, and psychologically. They are brought about by work overload, working overtime, safety issues, and understaffing, while taking care of patients with life-threatening illnesses and the like. In this regard, many nurses get burnout. These stressors affect the healthcare workers' mental health negatively. These not only affect the capacity of nurses to provide quality healthcare to their patients, but it also may lead to illness, absenteeism at work, or worse, mental health problems. I would like to humbly recommend implementing policies with regard to the nurse-patient ratio as started in BC. If implemented, patients will be equally distributed, workload will be lessened, thus decreasing stress. I would like to ask for a follow-up meeting regarding this matter. Thank you for your time.
At Conestoga College, today I want to bring attention to a critical issue affecting our elderly population in Canada, the hazards of hospitalization. Despite ongoing efforts, a staggering 17% of individuals aged 75 and above spend 30 days in acute care hospitals, exposing them to risks like falls, delirium, and infections. The hospitalizations not only affect their health but impact functionality and healthcare costs. I propose a transformative approach implementing specialized geriatric services in Canadian hospitals and healthcare facilities by focusing on enhancing independence, functional capacity, and overall quality of life for older individuals. As we address the challenges of our aging population, your support for increased access to specialized geriatric services is crucial. I would appreciate for a follow-up discussion to explore how we can collaboratively improve healthcare outcomes for seniors. Thank you for your time and consideration.
Good morning. Hello, everyone. My name is Pankti and I am a international nursing student from Conestoga College. Today I shed a light on a critical issue that demand our immediate attention, the long-term shortage crisis in Canada. Extensive research and analysis reveal a sobering reality. Our nation faces a shortage in critical resources, impacting our economic stability and societal well-being. This is not a challenge we can afford to ignore. The solution lies in strategic thinking, investment in education, and innovation approaches to address the root causes of this shortage. We must act quickly to secure a sustainable future for our great nation. I urge you to consider the evidence, understand the urgency, and join the hand in finding an impactful solution. Thanks a lot.